Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal compilation video today. So you can see from our first patient here, one ear very blocked up. You can see that we've got some very hard dry wax at the outer portion of the canal here, but attached to some dry skin behind, which is why it hasn't really migrated out very well. So I'm trying to use the standard size ulnar tube here to lift this wax from the bottom of the canal wall, because it's quite firmly stuck there, so we can start to peel this dry skin away behind. So as you can see, we're lifting from the bottom there, just trying to free it up from all the canal walls. You can see how firmly stuck, how firmly that wax is stuck there at the moment. So we've got a good grip there now. As we pull, you can start to see the little ribbon of dry skin that's been holding all of this in. So working this out to the outer part of the ear canal here, still trying to hold on to it. The difficulty with dry skin is it holds onto the canal walls really well. Obviously we don't want skin coming away from our bodies if we possibly can, so this one will hold in really tightly. The difficulty we have then is when you're trying to suction it away, especially when you've got a grip on this wax here, it means that the skin holds everything behind it. So we're going to use the crocodile forceps. I'm just going to slow everything down so you can see this coming away. Getting a good grip. This is on the outer part of the ear canal, so we're not in the canal at all here. And just pulling. I was hoping to get this away in one long strip, but you can see it all coming away. There we go. Just saw the back end of it coming away now. If we look in again, you can see that's brought the next section forward. So we're going to get a grip on that one, slowing the video down again. And just pulling this through. You can see a bit more clearly there, that long strip of dry skin that's been holding everything into place. And we've got a little bit left at the bottom there, so we'll just grab that with the forceps as well. Patient feeling much better if this comes away. Most patients experience, tell me they experience a bit of itchiness afterwards, because if you imagine we've taken all this old dry skin away, it just leaves that kind of itchy sensation underneath where it's come away. You can see how long these strips were. One was just over 1 centimetre, the other one the same really, so just under 2.5 centimetres. That's going to equate to about 1 inch, I think. Here we are, bang on 1 inch. So you can see that the darker section to the right hand side of both pieces, that was the wax, but look at how long those strips of dead skin were behind it. This is our second patient in the compilation. Similar story, gentleman's come through very blocked up on one side, very impacted wax. We seem to be getting a lot of older drier wax coming through at the beginning part of this year, so lots of impacted deeper type waxes coming through. What we can see here, we've got a slightly elongated shape to the canal. So rather than being a more standard rounder shape, this is more of an oval shape. The wax there, you can see has an indentation at the bottom, to the bottom left hand side there. That's from using a Q-tip. Patient in desperation has been trying to use Q-tips to clear this out, just to try and get some relief, but unfortunately it's compressed the wax against the canal walls, which just makes it a little bit more difficult to remove. So you can see I'm working down that left hand side, now across to the right hand side, trying to unstick this wax. It's very dry, crumbly type wax, this one. It's that we saw it in the video on Monday, I think it was. We had a really dry type of wax. This is a very similar type as well today. So just introduce a little bit of olive oil, which is going to help to try and loosen this off the canal wall. Just suctioned a little bit into the machine there, so we just had to clear the suction through. So you can see I'm adopting the same technique, which is just to gently scrape along the surface of the wax. Okay, not too deeply, but just to really scrape along, just to break any looser pieces away. You can see the film of olive oil there as we pass through that layer. But see just how dark and thick this wax has become. So we're just loosening here, just starting to take some of those pieces away there. There we go. You can see it's starting to peel away now from the left hand side. We're going to aim for this very narrow pinched valley here at the bottom. just lifting. This is just due to the shape of the canal. It's because it's that oval shape, we get this very narrow pinch point at the bottom. So it's really wedged in here. You can see we're getting a little bit of movement to the wax. We, as I've said in videos before, if you hold on to the wax and gently rock back and forth, you look for looser sections of the wax. You look for where the wax has got the most movement, and you know that bit's going to come up next. But you can see here that it's really rammed in there. Now, we're going to use the Jobson horn to try and break some of this down. Okay, I don't want to go in too deep with it, but I want to be able to break some of it away so that it gives me a bit of room in here to peel the sides away. So I've just slowed it down a little bit to watch this coming away. Here we go. You can see we've got that front section, and we've taken some of that little pinched valley at the bottom away as well. Now that's going to cause a groove down the center of the wax, which means we can then fold the wax in a little bit. So you can see there we've got that groove now in the center. We've still got this a lot of wax debris in that valley. I was hoping a little bit more would come out with the Jobson horn there. But now we're starting to peel away from the sides. You can see it's a lot easier now. We've got the room to peel this across. There's bits of dry skin in here, which are these longer strands you see pulling away from the wax there. All those are getting sucked into the machine. Now we're going to work on this darker section at the top here. Peeling across. You can see the white of the dry skin that's underneath it. Now trying to lift out of that valley again. Can you see the white layer there just as we lift? That's a bit of dry skin that's been underneath the wax. So we're just going to scrape along the surface again now. Just take any looser pieces away, because you can see as we move it, you get these little furrows that appear and little bits start lifting from the surface. Let's put a little bit more olive oil in here. Let's try if we can loosen this a little bit more. Always difficult when when the wax is pressed against the canal walls like this one is. You've got very little wiggle room, especially if you've got a very flat surface to the wax as well, which is what we have here. So the normal technique of wiggling back and forth doesn't really work, because you can get a grip on it, but it doesn't have the maneuverability, doesn't have the room either side to be able to move it out of the canal. You can see now the wax is starting to penetrate just above this top section here, so it's going to be loosening that section away, which is why we're getting that peel now. Look, can you see that coming down? So we're having to lift this from the back end here. Just starting to peel some of this section away. We're going to see lots of flaky bits of dry skin in here, I'd imagine, looking at the consistency of the wax. This drier type wax here, unless it's very old, which obviously this is as well, but tends to be when you get really dry skin issues inside the ear canal as well. You can see just how much it's peeling along the, see it peeling down, how at the top there, how firmly attached it was to the canal walls. There we are. It's starting to get a bit of movement to that top right section now. Really peeling that away. You can see the whole top section of this wax is starting to fold forwards. Just slowing this down now so we can get a grip. There we go. You can see this coming away. So that's the top section gone. And you can see it's really loosened that that top layer now. So we're going to get a little bit of movement now. Let's see if we can lift up. No, we're going to have to fold forwards then from the top down. There we go. See the movement to the whole thing? You just see the whole side start to move forwards. Slowing this down again. There we go. So we're peeling that top section away now. You saw that long string of dead skin coming away behind it then. And let's try and lift up from this bottom section. You can see a lot of that white dry skin there as well. You can start to see the pinkness as well to the canal walls here, where it's been aggravating the canal walls. So quite tender for this patient. There we go. Out it pops. Let's look behind that. A little bit of loose wax there at the top, so we'll take that away. You'll see this whole section. There we go. Fold into it. There's another piece there at the top. Let's get rid of that. Okay, so what we're left with now, we can start to see the eardrum there at the bottom. We've got these 2 patches of dry wax at the top, little tiny knobble of wax to the bottom right hand corner there as well. Everything else you see in there is dry skin. So I want to get rid of the wax first. Let's peel this section down. A little bit of olive oil on the camera. Let's clear that away before we do anything else. There we go. And then we're going to peel this top section down. Slowly, there we go, out it comes. We've slowed this part of the video down again. I know you guys have mentioned you like the slowing down, so I'm trying to do that as much as I can. This little piece here to the right hand side, let's get rid of that. Okay, now the canals, you can see, look how pink and aggravated they are. So I'm going to go very gently and see how much the patient can tolerate of clearing some of this dry skin away, because it's going to be quite firmly attached, and we're going to have to sort of dig into it to try and remove it. And patient was finding this a little bit uncomfortable. Now, because we got rid of the wax, the dry skin will dry out and will come away on its own now. So we'll try and clear as much as the patient will tolerate, but they've already sat through quite a bit. So you can see the eardrum. We've fixed the problem as far as the hearing is concerned. The rest of that dry skin will migrate out. You can see how dark, that reddy brown colour, long strips in there in the middle look of dry skin as well. So quite a bit coming out of one ear. It was very deep and impacted. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.